Tuesday, July 11th, 2023, and I'll make this next part short if you don't know who I am or what I'm doing here. My name is Joe Tillman, and I am a 21-year veteran of the hair transplant industry and a 30-year veteran of having had hair transplant surgery, having had a lot of hair transplants over the course of that 30 years. Yeah, we have liftoff. Hey, yeah, okay. And I tell people, I've had 10 hair transplants, but the reason why I've had 10 hair transplants, and I'm bringing this up because I saw a comment where someone was saying, well, you've had so many hair transplants, how come your hairline is not lower? Or you've had so many hair transplants, how come your hair isn't thicker? Or, some sort of comment like that. I've seen that recently. And not all my surgeries were designed to give me a lot of extra hair on top of my scalp. The surgeries, some of them were experimental. Like I had one of the earliest body hair transplant surgeries, but it was just a small in-clinic experiment to see how it would work. This is back in 2006, 2005, I think, actually. And one of them was a scar revision, strictly a scar revision. So I've had all these multiple surgeries, and I say 10 surgeries because I just want to be completely clear that I've had all these surgeries. Because in the past, when I'd say, well, I've had a few surgeries, and I think I used to say I had 4 or 5 surgeries, and then someone would say, well, what about the body hair that you had? It's like, well, okay, yeah, technically I had 6 or whatever. And so just being clear about every surgery I've had, both to repair my original situation from the 2 surgeries I had, the 2 bad surgeries, and then the little experimental ones like a scar revision, which wasn't experimental, but a scar revision, a body hair transplant, which was very small. And then I even had just an experimental FUE, just like a few grafts, with a different doctor, not my normal doctor, so he could test out a new punch. And that hurt like a son of a bitch. I'll never forget the pain on that one. It's the most painful thing I've ever been through as far as hair transplant surgery goes. But anyway, so yeah, I've got a lot of experience in the industry as a professional, and I've got a lot of experience as a patient. So with that out of the way, what am I doing now? Well, I'm doing what I'm doing right now. I have my podcast, my live stream, usually Monday through Thursday, depending on my schedule, and every Friday with Spencer Coburn on the Spencer Coburn's The Bald Truth. And I also work with several clinics, not many, but 15 different doctors. And I evaluate these doctors based on my standards, what I think is important for the outcome of a patient and how patients are treated and the work and just the artistry, things like that, with the number one priority being naturalness. So that's what I do. I have this YouTube channel. I have my Instagram at Joe Tillman Official, which is mainly just announcing my show on YouTube. A couple of things I'll put on there. But I also have my website, hairtransplantmentor.com, where I documented my entire journey up until, I don't think I documented my last surgery, but it's like you've seen enough of that. But every surgery before that, I could add that on there at some point. But yeah, so anyway, we're here on the main event, Tuesday, July 11th, and this is a call-in show, so you're welcome to give me a call to ask me questions about hair loss, hair transplant surgery, medications, future treatments, which I'll be talking about here shortly, and how it's affected you, hair loss or a hair transplant, or be a good hair transplant or even a bad hair transplant. How has it affected you? How has it changed your life? I'll tell you how it's changed my life. Aside from being a conduit into a career that I never imagined I'd ever have, it has allowed me to feel normal. it has allowed me to not feel like I stand out. And even if you've never had surgery, but you're losing your hair, that's how you feel. You feel like you are unique as far as, it in a negative manner. You feel like you are, I've seen some people throw the word pariah around, which is not the case. It's not true, but that's how a lot of people feel. You feel less than. And I get that because I've been there. But I don't believe that people with hair loss should feel that way. I felt that way because I had bad hair transplant surgery and I kept losing my hair because I didn't have medications. They were never explained to me that they existed because technically they didn't. It was around when ProScar was first given FDA clear approval for benign prostate hyperplasia, BPH, but not for hair loss as propecia. My journey started before that, so that was never even an option. And minoxidil was never explained to me. Topical minoxidil had been available for a few years, so I continued to lose hair. And as I continued to lose hair, my surgical hairline was being revealed because the work was placed behind my natural hairline. And I noticed eyeballs starting to look up at my hairline as opposed to my own eyeballs when I was talking to people. Because I've always been the kind of person to speak to someone in their eye, look them in the eye when I talk to them, just the way I was raised. So I noticed that very early on. And that's when it started to really affect me. Losing my hair didn't affect me nearly as much as having a bad hair transplant did. Not even the same league. It may be for other people, but not for me. So going through 9 years of having 2 bad hair transplants and continuously losing more and more hair and feeling more and more hopeless, to have that turned around by one surgery, just one, that's all it took, for me to feel normal again, even though my crown was bald, like still really bald after that first surgery, I didn't care. I did not care. For the first several months. I had a follow-up 9 months after my first surgery with Dr. Wong, and I drove back to the clinic. And that's what got me excited about doing a second surgery, because he said, after I asked if it was possible, he goes, "Oh yeah, you actually have a surprisingly robust donor area that bounces back after having a strip taken out." He goes, "I've never seen anything like it. You've already had 3 surgeries. Your scalp is as if it's never been touched." And that kind of continued. That was a theme with my surgeries over the years, to where even today, I still have some laxity on the sides. The back is a bit tighter, but it's weird actually. But having that first surgery and then the subsequent surgeries that all of them worked out fantastic. It changed my life for the better, to where I felt normal. And that's what it was always about for me. Not feeling like I was a freak or I was a pariah, that people would notice me. And people did notice me. I got some stories I've told about it, about my negative experiences with other people pointing out my surgeries. So maybe I'll talk about that again sometime. But yeah, so tell me, like, give me a call, guys. Like, let me know how it's affected you, or gals, any ladies out there that want to call in. That's more than fine. But yeah, when I'm starting the show, I usually don't really have anything prepared as far as a monologue goes. I just wing it, and God knows what's going to come out. So this came out talking about how having hair transplant surgery what it has meant for me. Again, aside from creating a a career that I never imagined. Before I got into hair, I was in enterprise level IT sales, where I would travel to different large tech companies and sell into them, yes, PCs, but also networks, network systems, routers, and large servers and things like that. And I was good at it, and I enjoyed it because I'm also kind of a geek. I love tech. To this day, I love tech. And I'd probably still be in that industry if I didn't get into hair, or I'd be a dive master in Fiji with my own dive boat, because I used to really be into diving as well. But anyway, yeah, so just kind of opened up a little bit of my history that I've not really shared much before. So you guys tell me, share something with me. Give me a call, 1-833-563-4247. The number is right here on the screen if you're watching on YouTube. If you're listening any sort of replay somewhere and not watching, the number is toll-free, 1-833-563-4247. You can use a calling app worldwide to call as well. We've had calls from Australia several times, Kazakhstan of all places, with May. He's always a good caller. Charlie, I think, in Poland. I've had, was it Romania? Yeah, it's nice hearing from people all over the world. So let's go to the chats going on. Rob, you got to leave for dinner. Okay, well, take care. Thanks for jumping in. Let's see. PJP, Joe, my crown is completely bald and I don't want to take meds. What do you recommend? That's a good question. I've had this one many times, and it's rare that I know exactly how to answer it because, every patient is different. But I think that, well, it depends on why you don't want to take meds, because I've talked to people in the past where they were, unfortunately, misinformed about how medication works or what it will and will not do. Where I've talked to people where they think taking finasteride actually increases the probability of getting aggressive forms of prostate cancer, when that's not what the studies actually said. It's a misinterpretation by a lot of people. It actually reduces the chances of some forms of prostate cancer, the less aggressive kinds. But which means that by process of elimination, if you do get prostate cancer while you're taking the medication, not because of taking the medication, but while taking, the probability of what you get would be more aggressive. It's an elimination issue, not the misinterpretation. So what I recommend, and it's not to take something all natural, because if you're lowering your DHT, It has nothing to do whether it's through synthetics or natural remedies. The side effects can be the same. If you take enough saw palmetto, if you take enough of that, you'll have the same side effects as Propecia, Proscar, generics, whatever. So with that out of the way, if you're really, really wanting to hang on to what you have, then there are non-medical treatments such as laser, which has shown to work in some patients. I did a video about this in my hair transplant class series, which is also found here on the Hair Transplant channel. In some cases, I've seen it work as well as some of the better medication cases. Is there a difference between the different lasers out there? I honestly don't think so, but I also don't know, because you're talking about the number of diodes, and now they've introduced LED, and I saw someone talking about infrared, which doesn't make any sense. So that would be an option. There's also various forms of platelet-rich plasma or exosomes, which is a whole whole nother arena to talk about. But even talking about baseline PRP applications, they're not the same from one clinic to the next. So that's another slippery slope where you got to find a clinic that has a demonstrated level of consistency with their application of PRP for their patients. So there's that. What else is there? Really not much. So you have to think long and hard about it. And then the next question is, are you considering surgery without medications? I know of a few people that have done that, have gone down that route, and it did actually work out for them in the long run. There was one in particular that I remember from the mid-2000s. Patient came in and he had crown work done, and if I remember correctly, he also had work in the anterior mid-scalp on back into the crown. He still had some hairline remaining. Sorry, no, he was a Norwood 5A. That's right, and he had the entire top rebuilt. Was not on medication, and for the, I'd say, 8 or 9 years that I followed him online, he seemed to be okay. But that is definitely the exception, not the rule. So I hope that answered your question. Let's see what else we got here. In the chat room, Milk Drinker, hey buddy, how do the hair angulations change as you lower the hairline? They can become, well, they should become, how do I explain this? Well, as you lower a hair, well, it depends on where. But as you're lowering the hairline from, say, the central area, as it's coming down, the angle, if you're talking about the exit angle, usually becomes a bit more sharp away from the plane of the scalp, because if it maintains a flatter angle to the plane of the scalp, then it's pointing down as it comes down on the forehead, which you don't really want. You want it to be, once it comes down, it actually becomes a bit more of a sharp angle away from the plane of the scalp. But there's also the direction. The direction as it comes down should be coming off to one side uniformly. Yeah, I mean, I could talk about this for quite a bit, but to answer your question, it's usually a bit more sharp away from the plane of the scalp. I hope that helps. DLLL? Hey mate, had complimentary PRP after hair transplant. What should I realistically expect from it? Should I continue PRP treatment if I don't really know if it's doing anything? Thanks, Joe. Diffuse thinner. You know, that's a great question. I'm not a big fan of PRP after or during surgery, because, well, let me back up. I'm a big fan of clean surgery, of surgery being performed properly, and leaving it alone as a standalone procedure, not being augmented by anything else other than medication that you have already hopefully been on leading up to the surgery. I think that if you're adding PRP, and if you had, like some clinics I even work with have that option, and that's fine. Like, I'm not canning it, but I just believe that good surgery should be good surgery. I can understand it as a backup, I guess, because the idea is that if there are any moderate slip-ups during the surgery where some of the grafts might be affected from, not being entirely crushed, but maybe a bit more compressed than they should be with forceps, or maybe cut a little too closely when being dissected under microscopes, if they're being dissected under microscopes, a little bit of damage of the papilla cells just because of whatever, then potentially that can help to push those affected grafts through to the other side to where they grow better. or they grow better. Yeah, they grow better had they not had this treatment otherwise. So there is that argument, and I get it. I totally get it. But because not all PRP is the same, we don't know what's going to do. If it's from a clinic that has a consistent record of successful PRP treatments, sure, okay, great. But then you ask the question, should I continue afterwards? And you said, if I don't notice any difference. Well, here's the thing. How would you notice any difference if you just had surgery at the same time? That's the other big issue. And this goes along with me, in my position on starting multiple treatments at the same time. If you're not taking anything and then you start taking finasteride and minoxidil, or Avodart and minoxidil, or any combination of multiple treatments at the same time, you don't know what's working and what's not working, because you might have a situation where, say, topical minoxidil is doing sweet nothing for you. I was about to curse. And then finasteride is doing all the heavy lifting, but you don't know the difference because you started them at the same time. One, the minoxidil might be doing nothing, or it might be doing everything, and finasteride might be doing nothing. You don't know. So you don't know which one to stop. So you're kind of locked in, effectively. Unless you are willing to take that chance of, well, it doesn't look like it's doing anything, and you stop taking it, and then, you don't go back for another treatment, and you're stuck. You've lost more hair. It's a tough one. It's a tough one, and that's another reason why I don't like. I'm not a fan of that being offered, and I got to say, I mean, if it's a complimentary PRP, what kind of quality is it? Because the quality PRP, and this is just my experience, when I see clinics that have a consistent record of success, relatively speaking, with their PRP treatments, they're not cheap. They're usually a couple grand at least, sometimes $3,000, or even a bit more. No one I work with offers it for like $5,000, but I know there's a doctor in New York that charges $5,000 a pop, and he makes some wild claims online. But how much quality is in that PRP if it's complimentary? Unless it was something worked out with your with your clinic for some reason. I've seen that, and it can be fine. But anyway, I'm starting to ramble on that, but I hope that answers the question. Let's see what else we got here. Before I get on this, phone line is open, 1-833-563-4247. Mike Pedrosa, what's up, Mike? How you doing, buddy? Joe, I noticed a difference after surgery when I started PRP and oral minoxidil. But where, Mike? Where did you notice a difference? Was it in the surgical area, or was it in areas that you didn't have surgery? I think that's important to point out. Sergey, hey Sergey. Joe, can the hairline look unnatural if too many singles are implanted on it? Let's assume they're implanted at a good density, not sparsely. I got to think about that question. I think it's a good question. Can it look unnatural if too many singles are placed densely? I don't think so. I think maybe the exception to that might be if they're placed too far into the hairline. You got me kind of stumped, because it's not something I've been asked before, and it's not something I've actually thought about. And I'm just visualizing what it would look like. And I think maybe if you're really zoned in on hairlines and that's your hobby, then maybe it would look unnatural. But I think that in a situation like that, it would have to be assuming angle and direction are done correctly, then I think it would be difficult to point out. But if someone's, if it was known that that surgery had been performed and the number of singles moved too far into the hairline, then I think it might be something that I could point out. That's a good question, man. You really have me thinking there. Yeah, okay. So is stem cell therapy effective for hair growth? I don't like the term stem cell therapy because it's very misleading. But PRP therapy, it is in the right hands. If you just joined the broadcast, I was saying earlier that PRP and exosomes, which would fall into that category, exosome treatments, they're very inconsistent from one clinic to the next because it's not the same. It's not a standardized process. Aside from drawing blood, throwing it into a centrifuge, that's the only thing that clinics have in common. The centrifuges are different. The types of centrifuges are different because a centrifuge is not a centrifuge. You got different kinds of centrifuges, closed systems, open systems, systems that can actually create a specific number of platelets. It's quite complicated, actually, if you're not used to it. Let's see. But yeah, they can be effective in the right hands. I think I said that. Jim73, some doctors still use ACell during a procedure. Others consider this old school and don't think it's beneficial at all. Yeah, no, that's true. I think that if it's used for its core ability, which is to improve healing, then I think it's okay. I remember when it first came out. In fact, I was the first person in the hair restoration industry to talk to the company about their product, and I remember that because I talked to the vice president of ACell at the time. I think he's now the CEO, or he became the CEO eventually. His name was Rodney Bosley. I never forgot that because of the obvious correlation with his name, which it's not the same Bosley. It's not related. And when I asked him about the probability of ACell extracellular matrix being used for the application of follicular regeneration, he was surprised at the idea, but he was also interested. And he told me, he said, we never considered that. He said, our main goal with this was to help to create an environment for burn victims to have restored skin, or to improve their skin as far as the recovery, so it's not so much scar tissue that a normal burn victim gets now. And they were working with, I think it was Walter Reed Hospital, military hospital, for quite a while, working with wounded soldiers, also looking into the unlikely prospect of regrowing limbs, or at least fingers, because that's how this got started, or the excitement about this got started when 60 Minutes had an article or a piece on this, where I forgot the guy's name, but he worked at University of Pennsylvania. He was behind a lot of this. His brother lopped off tip of his finger from the knuckle, applied the powder. Long story short, it grew back, fingernail and all. That's what got the ball rolling on this. But yeah, so the idea was improved healing, reduced scar formation, and that's what I thought it would be great for, and that's what it was used for in some situations. But some doctors, as soon as I was talking about this, I think on the Bald Truth, before I was even a part of the Bald Truth, I called into the show to talk about it, and a couple of doctors jumped on it thinking, I can start applying this to, regenerate follicles from FUE extraction, leaving part of the follicle behind. Anyway, I'm getting deep in the rabbit hole in here, but yeah, it's interesting. And if some doctors are still using it, I know some that are. Actually, some are mixing it with PRP, and and they think they see benefits with that. But in pure surgery, there can be benefits from it. Although, again, it's not consistent. Not a lot of doctors are using it. But there can be benefits with how scars form, reducing the severity of the scars. I've had doctors tell me that the scar tissue itself seems to be more pliable as opposed to hard, like scar tissue can be. Hope that answers that. Or it wasn't really a question, but yeah. Let's see. Joe, do you do any private consultations? Not really. I'll do, like, people can go to my Instagram, and I used to have a service where people could submit their photos and information, and if they wanted to, I could blur their faces out, but I would do a full consultation if they in turn would let me do the consultation as a YouTube video, because I thought it would be great, because a lot of people would be interested in seeing what a real consultation looks like as opposed to just hearing about it after the fact. Like, I would do a real consultation in real time in this video. And a couple people pitched. I think I did 4 of them. But I actually had a special form where they would, fill it out and they'd, basically agree to be on video, so I wouldn't be accused of doing things the wrong way. But yeah, it didn't turn out to be very popular, and I didn't think it would be, but I thought I'd give it a shot. I had hopes that it would be more popular, but a lot of people just don't want to be on camera, even if their faces are blurred out, and I understand that. So no sweat off my back, but I don't do them as far as like, hey, let's sit down face to face or let's do a video chat. What you can do is you can go to my Instagram, follow me at Joe Tillman Official, and submit a message request. And if I have time and you want to send me the photos and give me your backstory and anything you've been told by other clinics within the first few messages, because I don't like going back and forth, having to ask questions over and over, because it just gets monotonous. So if you can send me your photos, standard angles, all the sides, top, show me your donor area, and not just with your hair long and just styled, show me the density by lifting it up, then yeah, I can give you my thoughts, and we can go back and forth on a few messages. We can go from there. Yeah, I hope that answers your question. So, Joe, have you ever heard of Medical Wellness Center in Boston compounding 30% minoxidil cream? I am on it right now for about 2 months, and so far I haven't seen much regrowth. Should I be more patient? That's from Derek Jordan in the chat room. That's a good question. I have not heard of it. If you are not seeing any sort of results, assuming you're talking about good, but also bad, then that's unusual that you're not noticing anything with such a high concentration, which tells me that the cream itself might have questionable absorption qualities, because that's a lot of minoxidil topically. Like, aside from this, the most I ever heard about was Dr. Lee's 15% formulation. So I would expect something. If you're going to have a positive result, I would have expected at least some sort of signs of growth or some sort of signs of improvement at this time, shadows of improvement. But yeah, I mean, I'd give it at least 6 months to see if there's some sort of visible benefit, but also monitor negative side effects as well. Hope that helps. Let's see, any other questions? Tom Cotter, which hair transplant surgeon is best at producing natural-looking hairlines? I get this question all the time. I don't think that there is a single best doctor for any sort of goal, because it depends on, like, if we're talking about natural, it depends on, I was going to say it depends on what you think is natural, but I don't think, I think that there is a baseline that everyone should accept, and that is angle direction singles. That's indisputable, because that's how it looks. Like, you see someone With a hairline that was put there by Mother Nature, it's natural. And you see them in very specific angles, directions with singles in the front. Occasionally, you will see a double or a few doubles in a natural hairline, which is why I am not such a stickler about all singles. If there's a very small percentage, that's okay, as long as they're not really coarse and just standing out, because the physician in the clinic should know better. But I don't think there's a single best at producing natural hairlines. There are some very good doctors out there that make just hairlines that make me think I would never have guessed if I didn't know. Okay, got a call. Hey, you're on the main event. What's your name? Where are you calling from?
Yeah, this is Nate from Atlanta.
Hey, Nate from Atlanta. Do me a favor. Turn down the speaker in the background. I can hear the show.
Yeah, sure did.
Right on, man. What can I help you with?
All right, Joe. Just let me give you a little bit of a background. So I just had through 2 transplants.
You just had 2?
No, I had 2, not just had
okay.
2.
I was like, that's a trick.
I had my first one in 2019. I was, so to speak, completely uneducated about the subject.
Where'd you go?
I went to Athens, Greece. I think the place was called Advanced Hair Clinic.
Okay.
I did an okay job.
Yeah. I think I know them. Yeah.
I guess not being very educated and everything. I was a little bit scared. I was not on medication. Long story short, they did an okay job. They said that they put about 5,000 grafts.
Wow.
But about a year and a half later, I still had a little bit of diffuse thinning on the top. You could see through my scalp. I didn't completely lose all my grafts. So I looked okay. I think I was about a Norwood. Initially, I was about a Norwood 4 or 5, I think.
Okay.
I'm probably going to send you some pictures through another call. I was a little bit afraid of the medication because I was on finasteride in 2010, about 15 right now. So, and then I had a girlfriend that scared the bejesus out of me, and I stopped finasteride, even though it was excellent. I was taking the Propecia back then. Anyways.
Wait, so hold on. Now you got my attention. Your girlfriend scared the bejesus out of you? How?
Yeah, she basically told me, "Oh my God, don't take that stuff. You can be a eunuch, and it's gonna kill your libido and everything." And it is what it is, man. I stopped it, and believe it or not, I didn't have any side effects back then.
Okay.
And then going fast forward to 2019, I had a lot of hair loss. I was at Norwood.
Are you still with this woman?
Oh no, I'm not. No,
man,
no,
you got the short end of that stick, my friend. Not only was it not a worthwhile relationship, meaning it wasn't for longevity. She screwed you over with your hair. Like that's a tough one. That's a tough one, man. I'm sorry to hear that.
Yeah, that's true.
I'm sorry to hear that.
That's true. And if I'd stayed on it, maybe I wouldn't need a hair transplant. So anyways,
maybe
after the first one, after I saw that, I'm like, maybe I should have taken finasteride because I was scared.
Yeah.
They gave me the topical back then. Some of the results are questionable, even now looking back. So 2020,
who's they? They gave you the topical, and was it topical finasteride?
Yeah. They told me the topical, but I ignored their advice. Advanced Hair Clinic.
Okay.
And then 2 years later, like I said, there was, I'm not really sure. It was a combination of me not being really happy with my transplant. Seems like I needed more density in the front because even though they had a lot of coverage, you could see through my scalp through certain angles.
And you said that you were losing some of the grafts?
To be honest with you, I'm not really sure. But
Okay,
looking at
fair enough.
pictures, because I kept the record, and it seems like a lot of the hair was not there anymore that they grafted. So it's probably a combination of not improperly placed grafts, like you've said in many of your episodes. Me not taking finasteride, and their job was not the most stellar job.
And your hair loss, you said it was a Norwood 4, maybe Norwood 5. Was it diffused hair loss, or were you where you were losing hair, you were actually bald slick?
No, I was not bald slick at all. No, it
Okay.
was mostly diffuse hair loss in the front, in the forelocks, and the very top front.
Mm-hmm.
And that was very diffuse.
Okay,
and also I started losing.
Sorry, and your crown was how? What was the condition of your crown?
I started losing my crown also.
Okay.
So maybe, on another call, maybe on a Friday, I'm probably going to send you pictures, because right now I'm just super happy. I don't have everything back, but I think in 2020, I went to Dr. Cole.
Okay.
And he said he could help me out with just 1,500 grafts. And the result was just phenomenal. He basically just went between my hair. So the front now looks, I don't want to say thick, but there's like, if you look at it at a certain light, you can't even tell. The back, it's not full, of course, because I didn't put anything on the back.
Mm-hmm.
But now I am on topical finasteride.
Okay.
Ever since I went to Dr. Cole, so I go to a compounding pharmacy here in Atlanta. It's called Atlantic City Pharmacy.
Okay. And that's working out for you. Do you feel like your crown has responded well to the medication?
Well, last year I went and I did some exosomes. So it filled a little bit of the crown, and I went to Dr. Lee, and who's here in Atlanta,
Mm-hmm.
and he's with another doctor that you had in your show. I forgot his name.
Yeah, Dr. Ken Anderson.
Anderson.
Yeah,
Anderson, right,
I didn't have him on this show. It was on The Bald Truth. Yeah.
Right.
Yeah.
So I was happy with that, because that helped also. So it's not, I can't say that my back is full, but at least my front is very full. Anyway, Dr. Cole did an amazing job.
Let me stop you again. So I want to get the timeline here. So you had your second surgery with Dr. Cole when, in 2020, you said, or 2021?
It was the November 2020.
Okay.
And then September of 2022, I had the exosome.
Okay. All right. And the reason I was asking is because I want to make sure you didn't have the exosomes while your scalp was still yet to respond to finasteride. So my question is going to be, well, how do you know it was exosomes or finasteride? Like,
Right.
You don't know, but you waited, and that's good. Okay, so you're
Right.
it makes sense that you can see that the exosomes actually help. So that's great. Good to hear. But how did the finasteride work out for you? Did you feel like that worked out well?
So that's a little bit of a difficult question. I'll explain why.
Okay.
I haven't really seen any. I asked Dr. Lee the same thing, and it's like the fact that you're asking and you don't really know means that it's working, meaning that you're not losing hair. So that means that it's working. I haven't really seen it done like miracles like it did back in 2012, but I was taking Propecia back then. Now, topical is obviously generic. And here comes...
Sorry. So when you were talking to Dr. Lee about this, and he said, well, because you've not seen any degradation, it means it's working. Was this before he did the exosomes, or was this a follow-up?
It was before and after, because I asked him both times. At the time I was full on. Ever since I left Dr. Cole, I was on finasteride. So I haven't stopped ever since.
Okay. I'll say that maybe his answer at the time was a bit premature because you hadn't been on it for very long. And more specifically, or more importantly, it wasn't a lot of time to see any sort of degradation and loss. How old are you?
I'm 50.
You're 50. Okay, yeah. So you probably wouldn't have seen much of a quantifiable difference over the course of a year and a half of loss in the crown anyway. But it also doesn't, it also means that, he could be right on that. And I would say it's somewhere in between, maybe. But yeah, I mean, it's no reason to think it's not working at that point, I guess. Yeah. Okay. So yeah, I'll just give my commentary on what he said. Continue, please.
Yeah. So now here comes a question. So lately, I've been very regular on putting finasteride on my head. And I've been listening to a lot of your episodes, so I've been getting educated. I'm an engineer, by the way, so I like to break things down.
Oh boy, you're my favorite kind of patient.
Yeah, I know, man. So
not.
so what's been happening lately, like very lately, like past 2 months? The finasteride that comes, I use the foam that comes from the compounding pharmacy. It's kind of very liquidy, because it used to come out as a foam. Now it's very liquidy.
Uh-huh.
So I'm questioning whether they're using the same vendor, like you've been saying in your episodes, or maybe they're compounding differently. So I did get in touch with them today, and I said, listen, I've been complaining this for the past 2 months, and I need to get to the bottom of this because I don't really know what the problem is.
Yeah.
I said, I've tried everything from cutting the tubes, for basically trying to see if the thing aerates. I tried different bottles because I used some of the bottles for that reason. I said, I tried to reverse engineer the whole thing to see if there's anything mechanical, but there isn't. So it seems to me that there might be an issue with the actual compounding of the two ingredients, or that you've changed the. So
what they say?
The vendor. Well, they said, well, let me do some investigation, and now they're going to get back with me tomorrow. So my question is, knowing that the actual Propecia has worked for me in the past. Now, of course, I was a lot younger back then. Do you think that, number one, and of course I didn't have side effects back then either.
Mm-hmm. Should you switch to oral?
Do you think, is there any validity to think that, number one, I could maybe not have side effects now? Number two, I'm afraid of shedding. Because I noticed that you said in the past that this is because you're changing the chemical and it could be coming from a different vendor. There could be shedding. And number three, if there's going to be maybe a different result or maybe see some thickening.
Yeah. Good questions. I think that, well, first off, I don't like the idea of, pharmacies changing stuff like this, where you're having to contact them and say, yo, what's going on with my medication? Why is it different? And then them having to say, well, I have to investigate this. It's like, haven't you noticed? Am I the only one that's asking this question? Like, that's kind of, well, it obviously means you're an intelligent individual. You listen to the show, so you're learning, which I thank you for. I think that, The main question is, can you or should you switch to oral? It's a tough question to answer because, number one, I'm not a doctor. Just get that out of the way. But the question for me is more of a preference. Mm-hmm. My preference is, I prefer. Personally, for my own case, I do prefer oral finasteride over topical finasteride. Only because, well, two reasons. One, I don't like having to leave it in my hair for a long time for it to work, because you can't just put it in your hair. Like I was taking this one. I'll go ahead and say I was using the precursor to Zion.
Okay. I saw that yesterday.
Yeah.
Advertised.
Because I used to work for the doctor, and I can get it locally at the pharmacy where all this originated, and that's what I was doing. And I actually loved using it because it's the greatest hairstyling product ever made, bar none.
Wow.
For me, man, it was fantastic. I loved using it. It felt like you press the plunger to have it come out onto your hand so you can, rub it before you put it in your hair on your scalp, and it had the consistency of Arm & Hammer baking soda toothpaste. It looked like it. It looked like it and felt like it, except it wasn't sticky like toothpaste would be. But it had that same consistency. And then I'd rub it on my scalp, and I'd leave it there for a couple minutes, and then I'd comb it through, just so that my hair wouldn't dry, looking like Phyllis Diller. There's a old reference for people. And then before it would fully dry, I would blow dry my hair, and it was a great thickening agent. My God, like it was fantastic. Like if I could buy that without the finasteride, just as a styling product, I'd be set. I love that stuff for fine hair. Doesn't get any better. But as far as the the difference between topical and oral, I personally still believe that for most people, oral finasteride is better than topical, only because of the
consistency.
Well, two facts: the consistency and the issue with generics, because all topicals use generic. Full stop. There's not a single topical out there that uses name brand because it'd just be too expensive.
Even Zion?
I don't want to say that for a fact because I don't know, but I don't see how they would be using name brand. I know it's a pricey product compared to most. I highly doubt. I would be 1% away from saying absolutely not as fact, but I can't say it as fact because I don't know. But I can say, generally speaking, I can't see any of these topicals using anything but generics. So the question is, what quality? What's the quality of the generic? You've got two generics I do know of, or two topicals I do know of, are sourcing their finasteride in North America, and that is the topical from Dr. Yaker in Dallas, Texas, which is a really good topical, and he's maintaining one source. He's working with the actual manufacturer of the finasteride generic, and he's actually running quality assurance tests every few weeks or once a month just to make sure of the quality. So that's a big deal. The other one is Happy Head from Dr. Sean Bainham in L.A. That's his topical Happy Head, which apparently is pretty popular and growing in popularity. And I was talking to him about it the other day, and he said, I absolutely source it North America only because I believe, and he actually referenced the show. He goes, you talk about this all the time, and I'm a believer in that. So it's like, okay, great. So those are two I think that would be worth considering, but are they as good as oral? Well, that's a physiological issue and how your body responds to either one. So I can't answer that. For me, I'd be going with an oral unless I found through experimentation a topical that I know is consistent. I know the source. I know that the people pushing it are anal retentive about the quality, like I know these two doctors are. So I would seriously consider using either one of those two in the future if the situation occurred, if the situation presented itself where I could. But as far as you didn't have any side effects with oral before. There's no reason why you'd have side effects now. That I can think of. I could be wrong. But your age, I don't think has anything to do with it. So you are you now, just like you were you when you're taking it before. So I don't see why it would affect you any differently.
So if I switch to oral, how would I approach this? Would I incrementally, kind of like do both at the same time and maybe take half a pill?
That's my my idea. That's my feeling on the subject. If you're replacing one medication with another, then you slowly titrate down on the former and slowly titrate up on the latter simultaneously.
Right.
Simultaneously. So, for instance, if you're taking the topical daily, which you probably are, then are you doing it twice daily or once daily?
No, I just do it once. I do the 0.25% because initially with Dr. Cole for the first 8 months, I was doing the 0.1.
Yeah.
And then I switched to the 0.2.
Okay. So
0.25.
So in that case, what you want to do, or what I would do, you do you, bro. All right. But what I would do is I would go from every day with the topical to every other day. And then on those days that I'm not taking it, I would take the oral.
The whole pill?
Yeah. If you're talking 1 milligram, yeah. And then do that for a month. See how you feel.
Okay.
Month two, I would take the I would actually cut back to Monday, Wednesday, Friday with the topical. And then Tuesday, Thursday, Saturday, Sunday, do the oral if you want to maintain a daily schedule. And then see how you feel after 1 month. Month 3, take your topical on Tuesdays and Thursdays, and then the other days take your oral. See how you feel. If everything's good, then the final month, just eliminate it, the topical, and continue with the oral daily. See how you feel.
That sounds like good. That sounds like good advice, man. I think in this case, I'm probably willing to experiment because, like you said, if I had seen any side effects back then, it would be prevalent. I would have known, I guess, but I don't remember any side effects. I mean, I was just fine.
Well, if you had side effects that your girlfriend at the time was warning you about, you'd certainly know it, and she'd know it too. Like, come on. Let's be real about it.
Exactly.
So I'm sorry that you had that girlfriend because she was obviously not good for you. Probably in more ways than one. Just saying. Man to man. Just saying. But So that's. I hope that helps. I think that's probably if you want to go down this route, that's the way I would do it. But also talk to Dr. Cole about it. See what he says. Find out what this pharmacy. Yeah. I want to know what the pharmacy says. Actually, I think that's really important. So, I'm gonna talk to them tomorrow. Yeah, depending on what time you find out. You're in Atlanta, so you're 3 hours ahead of me. So by the time I'm going on air, you should already know. So give me a call tomorrow. Let me know if I'm on tomorrow.
Oh, sure.
Yeah.
So are you on every day, Joe?
Not really. Like I try to be. But life gets in the way. Like I don't make this a priority because I do have other things. But if I have time, so I try to make time if I don't have time. But sometimes I got priorities. I got to get out of the way. Like I'm working on a video. I almost didn't come on today because I got a video. I'm like really trying to finish. I'm right there at the finish line. And it's killing me that it's not done now. But I decided I need this break. So that's why I'm here today, but I should be back tomorrow as well. So look for me. You're subscribed to the channel, yes?
Yes. Let me see. I'm subscribed to the. Hold on a second. Let me see.
You better be.
I am. Yeah, I know I am for a fact. I'm already subscribed.
Okay. All right. Good stuff. So you'll get the notification, and you can jump on and give me a call tomorrow. Okay.
Yeah, sure. And just one more question I wanted to ask. So if I wanted to get to the topicals, you mentioned the other topicals from Dr. Yeager and the Happy Head. If I want to get topicals for that, do you actually have to go through consultation with those doctors?
Yes.
Or you can just order online?
No.
And
you got to go to consultation. As far as I know, you got to go through. Well, I know you do with Dr. Yeager. I don't know about Dr. Banham, but find out. Just if you're interested in either product, give him a call. I know that Dr. Yeager charges for his consultations, which I have no problem with that. I encourage that actually. I think it's healthy. Dr. Banham, maybe, I don't know, but
gotcha.
Yeah, just find out. And I got to ask you a question. Why'd you go to Greece? Are you Greek?
Yeah, I am.
and you went to Atlanta. Okay. And why'd you pick them?
Like I said, just a shiny object, man. It seems like they just really had good pictures. I went and visited the clinic. They looked, it looked pretty legit. They had very luxury. Over there, things are just, presentation is king over there.
Of course.
So it was very, very well presented, like a lot of the good clinics that you probably know in Turkey.
I know some good clinics in Greece. So
in Athens, yeah,
it's not as prevalent as Turkey, obviously, but I was hoping that you were. Yeah, I was hoping you were going to say you went to like a Choi Expert or something. They're a good clinic, but anyway, okay. So, well, look, I appreciate your call, I really do, and I really want to hear what these people tell you. So, please call back tomorrow if I'm on and fill me in. Okay.
Sure thing, man. I appreciate your help, Joe.
All right, my pleasure.
Thanks
Take
for
care.
everything, man.
Yeah, cheers. Thank you. Bye.
Bye-bye.
All right, number is 1-833-563-4247. That's toll-free North America, and you can use a calling app worldwide. Give me a call. Don't know if it'll cost you anything, but it's a few bucks at most. Don't be cheap. Let's see. I know there's some activity in the chat room. That was an interesting call. I'm getting more and more interest in this generic the resources that these topicals are using. Let's see. Someone said something interesting. Tom Cotter. Let's see. No, not the hairline thing. There's good evidence that your topical is going systemic at the concentrations it's formulated at anyways. There are some manufacturers or suppliers of topicals that are making the claim that their formulation does not go systemic, that things are trapped at the top. And my question is, if that's true, why are there people talking about side effects? Because it goes systemic, topically. The degree of systemic absorption varies from person to person, from topical to topical. There is no rhyme or reason to it. But if you see any topical that says no side effects, move on to the next one. Because the way I look at it is, it may work, but why do you want to support a product that's lying? That's false. It's demonstrably false. Because there are people out there talking about side effects. So just be careful, people. Topical does not mean automatically no side effects. Just saying. Sergey in the chat room asked me, Joe, do you think it's possible, at least theoretically, to create a more or less natural looking hairline using beard grafts only? Boy, that would be... I think yes, but only in the case where the scalp hair is equally as coarse as the beard hair. And of course, the scalp hair that's still there, that's still growing, is fairly straight or a similar growth style to beard hair. Like my beard does not get curly as it gets longer. It stays fairly more or less straight. Maybe a slight wave to it. I've grown it like, I don't know, 3 inches or so, like this. I've had it pretty bushy in the past, and it doesn't get real curly. So it'd have to be like that. It would be terrible for. I would even be hesitant to put it as filler in my scalp. I've had a couple of doctors salivating over my beard. They're like, "Oh my God, I could get 3,000 out of that without blinking an eye." I'd be really hesitant because I'm very picky about hair types and mixing and matching, and I would be really worried that the beard hair would be standing out because my scalp hair is obviously very different from my beard hair. My beard is very salt and pepper right now. It's more salt than pepper as I get older. My scalp hair still has a lot of brown in it, I think. Looks like it does. With some salt mixed in at a much lower ratio than my beard. It's inverse of the ratio of salt in my beard right now. But more so than that, it would be the texture that would really be standing out. Not for me. I was actually thinking about it earlier today. It's like I have a lot of chest hair, as FSK in the chat room never fails to remind me. And that would work a lot better for me if the survival rate would be reasonable. If I knew I'd get 80% survival rate, or I felt confident in that, you'd probably see me going for another session, and it would be a lot of hair, and taking scalp hair to rebuild a hairline lower with temple points forward, and then scalp hair used, or chest hair used, to fill in more of my crown. That would be my ultimate final hurrah for a hair transplant if I decided to utilize chest hair. Beard hair, only one scenario where that would work, and it's if the patient had similar texture, coarseness, waviness, or lack thereof to their scalp hair. That's the only situation I think that would work. And I think that the beard hair itself would have to be of a lower level coarseness than some other beard hair. Like, it'd have to be some special beard hair. I don't think it would work with just any beard hair. I hope that answers your question. Good question. I've had that question asked before, and I just like, no, never. But then when I think about it after you asked me, I did kind of open my mind a little bit and thought of some more scenarios. And yeah, I think of one scenario that would be okay. Yeah, FSK, Rob Williams, exactly. Let's see other questions. By the way, phone line is open, 1-833-563-4247. People, it is 4:18 p.m. Pacific time. I'm answering questions. The chat room had a great caller from Georgia, from Atlanta, Georgia. That was a good call. But line's open, people. Give me a call. And hit that like button. Do me a favor, hit the like button. Let me know that you appreciate me sitting here on my ass talking to you about hair loss and hair transplant surgery. I'm always talking about this or thinking about this every day. And it's nice to be able to talk about it in this format. Now, I do it on Fridays with Spencer, but where it's just me behind the microphone, it's grown on me. It was tough at first. Not tough. The tough part was multitasking everything else. Oh, here we go. Got another call. See who this is. Hey, you're on the main event. What's your name and where are you calling from?
Hey, how you doing? It's James from Delaware.
Hello, James from Delaware. How are you doing, my friend? What can I help you with?
Oh, man, listen, the struggle is real. And to all of my hair transplant brethren and sisterin, look, it's a struggle. I'm in month 3, and oh man, it's like I'm getting growth, but the around the the donor area and the sides are growing faster. So You know,
Yes.
I'm at a dilemma. I want to, you know, cut it down to make it even, but I don't want to touch it at all. It looks, you know, the growth is there.
Uh-huh.
As you know, the recipient site doesn't grow as fast as the sides of the donor area. By the way, my donor is magnificent. It's absolutely fabulous. I went to a clinic stateside, and, you know, I paid a pretty penny, but in my opinion, it's worth every penny. And it's my second one. And so in total, I got 4,000 grafts, 1,500 the first time. That was in like 2015, and then, you know, 2023. So my question is, you know, with you being as experienced and having as many surgeries as you've had, would you, if it were you, would you cut the sides to make it even, or would you just leave it alone?
Brother, you have not looked at my history. You just heard about it. That's all. And you can't tell me that you have, because if you had, you'd know the answer to this question before it even came out your mouth. I shaved my head. My second surgery with Dr. Wong.
Yeah.
No. It was was it my second? Wait, hang on. I got to think about this. My first one. Yeah. My second surgery with Dr. Wong. I still wasn't working for the clinic yet. I was, I'd taken a break away from, working the tech industry because of the first bubble that burst around 2001 in there.
Okay.
It made a horrible environment for working the industry. So I got into the mortgage business for a bit.
Okay.
Fucking hated the mortgage. I hated the mortgage. That was
rough industry.
God,
Very rough industry.
That was a bad move. Anyway, so I'd actually interviewed with a company on a Thursday, gone up to have my second surgery on Friday, and then started my job on Monday. And and the night before, like on Sunday night, I was looking at my hair. I'm like, I can't, like, what the hell was I thinking? I can't go to work like this. And so what I did is I got my beard and mustache trimmer and I shaved my donor area. Staples, remember, I had a strip surgery, and Dr. Wong and Dr. Hassan used staples.
Yeah.
Staples were fully visible.
Wow.
So I walked in to my new job that hadn't started yet, like the day one, looking a little bit different than when I was in the interview. Just a bit.
Oh, wow.
Just a bit. My entire top of my head had, you know, all these little 2,425 scabs on them, give or take. And my donor area was not only shaved down, but I had an inflamed line covered by staples going from one side of my scalp around the back to the other side.
Oh, wow.
So, yeah, you can how do I feel about it? Knock yourself out. Have fun with it.
So you know, it's a dilemma because, you know, one of the things that you did say, and by the way, I was watching one of your retro videos, the one with you and your wife going to, I think, Costco.
Oh, yeah.
I saw that one, and you were talking about shaving it down.
Yeah.
I thought, but you were actually talking about how you were walking in the snow and it was blowing. Great video. So, you know, I play around with it in my mind because I know that. All right. So one of the things is that you said in a past show, don't stop watching so many hair transplant videos. And right now I got Afro curly hair, and I'm watching these videos. I can't help it. You know, it's like, it's kind of an addiction since I got the second transplant, but I'm watching, and, you know, I'm seeing all of these hair transplant vloggers and influencers, and it's like night and day. They go in for the surgery, and I know that they're like editing and stuff, but then you see them with braids or, or everything is full and even. So I've been watching enough videos, and one video in particular, I can't remember the influencer's name, but the guy was showing his progress.
Yeah.
But I noticed his sides were even. The top was growing. I was like scratching my head, and I'm like, those are really good results. It's coming along well. And I go to the mirror, and I'm thinking, I need to even this out. But then it just dawned on me. I said, these guys have to be cutting the sides as the top grows. Yeah. And then when it grows to a certain length, they'll let the sides grow out to catch up. I mean, am I right or?
Yeah. Yeah. Well, that's another advantage to cutting your hair in the donor area as your result is still, taking its time to come in, is it balances things out, and it creates less of a visual deficiency for the top, because if the sides are really short, then the top being more bare doesn't stand out as much. Because if you got your hair longer in the sides and the back, and the top of your scalp is still really short with the hair that's there, and the transplants haven't grown in, then you look like Krusty the Clown.
It's interesting you say that. So, I'm feeling myself, and my confidence is like, my confidence never really took a hit. As I told you, I kind of was getting more ladies
I believe
with a bald head than the transplant. But I go to, I'm like, you know what? It's hot. I'm tired of wearing a hat.
Yeah.
You know what I mean? So I go to the supermarket, and the sides are long and the top is short. And this girl, real pretty, she's coming out of the store. No. She was coming out of the store as I was going in, and we're passing the window. I just glanced over, and she stops, and she just looks. And the expression on her face was like, this guy really needs a haircut. You know what I mean? Yeah. So I'm saying to myself, like, I don't want to cut it because I'm struggling with, I want to let it grow, and I'm kind of afraid that I'm going to mess with the recipient area. But I'm thinking at 3 months, it's the grafts are anchored in. Pretty much my growth is going to continue as long as I don't do anything directly to the recipient site. You know what I mean? I'm thinking it's time that I even it up. Now, another question that I have is, I noticed a lot of influencers are wearing head coverings. So a lot of them, you go to their videos and you see, and they're like, oh, the big reveal. And they've got like a do-rag on or a head covering on, or with the females, they'll have a bonnet on and things like that. Mm-hmm. Is that recommended? Now, I know I posed that question to my medical provider, and the consultant came back and said you can, as long as it isn't too tight. But also the consultants, because some of these clinics, they have multiple consultants answering your questions.
Yeah.
So I got some conflicting information on one question. So I kind of was scratching my head thinking, I don't know if these consultants are as knowledgeable, as the clinicians, the technicians, or even the doctors. Because once you get your surgery and they're done with you, pretty much they're passing you to the consultants or the receptionist to answer your emails and things of that nature.
Well, so, okay, so just so you understand, there, and this is for the benefit of people watching and listening, in a well-run clinic, you'll many times have a situation where the consultant consults. They're not there. Right. They're not there to do post-op follow up. They're not there to be the resource for ongoing questions after the surgery. There is a patient coordinator, or not patient coordinator, but like a patient affairs. They'll have different titles, and they're all meaningless. They mean something in that clinic, but they really don't mean anything as far as what the job does, because I've seen one title used for multiple different positions, and it's yeah. Anyway, so and you'll have one person whose job is to answer questions as they come in after surgery, and that's why you're handed off to different people in some clinics. Other clinics, like it is a situation where you'll have a consultant that brings you in the door. That's their job, answering your questions, making you feel comfortable. And then they are the person that you deal with as follow-up if you have questions. Sometimes it's the doctor. It just depends on the structure, it depends on the size, it depends on the volume of people coming through. And it depends. I mean, it's variable, and there is no right or wrong way as far as I'm concerned. The thing that matters is consistency, like you talked about. I do, and just to correct what I just said, I do believe that there should be consistency, that if you're dealing with one person for your follow-up, then it should just be that one person. There can be situations, obviously, where, someone's sick and, you got no choice or what have you. But I just want to make sure that that's clear, that it's different in different clinics, but it doesn't mean that one approach is better than the other. Because each clinic has its own unique situation and how they work. It's the clinic culture. But what you said about not knowing if they actually know what they're talking about, that's absolutely true. In some clinics, like even when even the doctors sometimes don't know. But I've been to some places where I'm talking to a consultant, either in a social setting, like at a conference, or actually at a clinic. Because I have been to clinics that have applied to be, a part of what I do, and I turn them down after I visit, and so you don't hear about them. But I have been to clinics where I didn't think that it was a great clinic to bring on board, and one of the things I saw or I realized was that the consultant was, and I can't get into specifics because I don't want them to feel terrible, but the consultants were really just glorified used car salesmen. They knew just enough to be dangerous. Like they knew just enough to get to show you the shiny things that interest you, but they can't show you under the hood and explain how things work.
Right.
If that makes sense. So, and I'm not saying that's what's going on in your situation where you said that you got an inconsistent answer from one consultant to the next, or one follow-up person to the next. But to answer your question about being able to wear coverings of some sort, it depends on how long after surgery. Like in my case, I was able to, like, I was given a ball cap, and there's a very specific way to put the ball cap on, where the hat itself isn't touching the recipient site where the grafts are placed. And the clinic shows you how to put it on. They show you how to take it off, and they're very clear about this. And they tell you, a bandana is actually a bad idea the first week, because if you have a graft or grafts that are seeping, where there's leakage, either from blood or from sebum buildup, which is what creates that amber colored coating that you'll see on some scalps. It can stick to the bandana, and when you take the bandana off, guess what? Rips out a graft. Not a good thing, right? But if it's after, say, a week or week and a half, when most of the scabs are gone, there's nothing wrong with it. You can they can wear whatever you want. Now, the exception to that is if you're in an occupation where you need a helmet, like construction, and especially if you had strip surgery, that buckle that's at the back of every construction helmet usually lays right there where that strip excision was, and that can irritate it. If you had FUE, that can also be an issue if that buckle is going through an area where there's some extractions. So, as far as the way they sit on your scalp, that's not really an issue, but you just need to be careful. Like, use your best judgment and observe, but talk to your clinic, talk to the doctor. Like something like this, if you don't feel good about the answer, see if you can talk to the doctor. You should have access to the doctor at some point.
Yeah, they gave me a direct number, and but I mean, the truth is, I mean, the doctor would probably say, yeah, I'll get back to you, or you call right away. It's not going to be like the doctor's waiting for you to call. The doctor's got patients and things like that, you know what I mean? So it'd be like you probably call and then leave a message, and then they'll get back to you if once their schedule allows and things of that nature. So
yeah,
and that in that term, I'd like to deal with the consultants and things like that, but I just think that these are like little nuanced questions, and sometimes I feel like I should know the answer, or go to YouTube to get the answer. But YouTube is kind of dangerous. You know what I mean? These influencers are pumping out a lot of misinformation, and things, and they're making things look way better and way easier than what they are. I mean,
that's their job because they're getting paid for it.
The struggle is real when it comes to this hair transplant stuff. You pay all of this money. In my case, I paid upwards with both transplants the price of a used car certified off the lot.
Yeah, look,
you know what I mean? I'm happy about
James,
the whole thing, but
it's their job.
Yeah.
It's their job to make it look easy because they got paid for their endorsement, or they at the very least they got their flight and depending on where they went and surgery done on the house. Like I was offered this before by a clinic in Turkey that I do not work with, but I was offered this by a clinic. I actually went into this this is a funny story. So back in 2015, on my second visit to Turkey, I actually went into a clinic undercover, and I recorded my interactions with this clinic where I did like a pre-consultation, and then I actually had a consultation with the doctor, and like it was this whole thing. It was a two-part video I made, and years later, about 2 years later, or sorry, about 5 years later, which was 3 years ago, I got contacted via email from a marketing company out of Germany, and they happened to work for that clinic that I was at. And they reached out to me and said, "Hey, look, we love what you're doing, blah blah blah," stroking me, and said, "We'd like to work with you, and specifically, we would like to offer you 10,000 euros.
Wow, that's a lot of money.
And we will fly you. We'll put you on a plane. We'll fly you to Turkey, and we will perform a hair transplant for you or a friend." So it would be two people, like you and a friend can come, and either you or your friend can have the surgery as long as you document it. And
wow,
yeah. So all these influencers where you see them, I can't say all of them. I strike that. I can't say all of them, but these people that have large followings already, like Greg Doucette, the fitness guy, he's got several 100,000, maybe 1 million followers. I don't know. I know that he was offered and took this deal. Like, I don't have the paperwork, but like I know that's what happened.
Yeah.
There are others out there as well. Any of these big names that are going to Turkey, they're being paid to go to Turkey. Because if you're making all this money, it's like, I mean, to be fair, a lot of people with a lot of money are going to Turkey just because they think that's the capital of the world for hair transplants. For sheer numbers, it is. But Dr. Yazdan had called into our show on Friday talking about one of his buddies who's a billionaire went to Turkey, not because it was cheap, but because he thought it was the best place to go.
Wow, for a conversation piece. You went to Turkey, or I went to Turkey too.
Yeah, exactly. Wow. And so, he went on to talk about how he had to fix it. So, but back to your point, all of these influencers that have, a sizable following, yeah, that's what happened. They got paid, and the surgery was free, or a combination of things happened. But so to go back to my statement, That's what they're supposed to do. That's their job, more or less.
So it's not, goodness gracious, because this is, I'm trying to wean off of, YouTube and watching these influencers. It's kind of motivational to me as I watch minds grow. But when I see these videos, it's sort of like magic, and their results are like super optimal.
Yeah.
It's like almost, it's sort of like a filter, if you will, like watching, one of these platforms and people got the filters on, and you're thinking, wow, is that how they really look? But it can't be. Like, there's no way in 3 months they have a full head of hair and, like, everything. It looks like they've never had a transplant. I'm thinking they're wearing wigs. I don't know, but it gives me anxiety to a degree because, I'm weighing my results against their results or using what I see on YouTube as the standard, and it's unhealthy. It really is.
Exactly. And I got to say, look, I really like it when you call. I appreciate your calls and I appreciate your support. I'm going to urge you to leave all of this alone for the next 6 months. You're 3 months in now.
Yeah.
Okay. Just leave it alone, all of it, for the next 6 months, including this show. Don't watch the show. Don't watch YouTube videos. Don't go to forums. For God's sake, don't go to forums. Just forget about it, because nothing that you watch, nothing that you learn, nothing that you see, hear will change what happens to your scalp. What will change how your result comes in? Nothing. You're not going to learn anything new that can change the outcome. You're not going to have some sort of treatment that you're going to hear about that you don't know about now that will influence the outcome. 3 months in, you got nine months more of time for your result to do what it's going to do. Whether you watch videos or not, whether you go to forums or not. So if it's stressing you out, which I understand why, you're not the only one, stresses a lot of people out, then don't do it. You get all the benefit and zero downside from walking away and just living your life. Cut your hair the way you want, like cut it down short in the back and the sides, like we're talking about. So even things up so you don't look like Krusty the Clown. All right, and just let it do what it's got to do. Follow your clinic's instructions. If you got questions about the progress, call them. Talk to your doctor. Don't let him brush you off. Your doctor shouldn't be brushing you off if that's what you're afraid of. Okay, and please don't tell me he has already.
No, he has not.
Okay, good.
I'm only reaching out to the consultants, which I'm fairly comfortable with that. I was kind of saving, to call to the doctor for like an emergency, but as long as everything is coasting smooth, and I'm comfortable with the results, I'm comfortable with the growth, I'm comfortable with everything that I see. It's just,
there's no reason for you to continue watching the show or watching videos until later. Okay. And just one final comment about the doctor, and you're talking about the only calling him for emergencies. I think that an ideal reason to call your doctor is to let him know about the conflicting answers you got from 2 of his employees, so that he knows about it, so he can call him, get them together after he's done with you and gives you the right answer, whatever that answer may be, according to him, and say, look, just had this call. He got 2 conflicting answers from both of you. We need to get on the same page on this. You guys need to understand this. So it's an opportunity for him to improve his clinic for the next guy. Okay?
That makes sense.
So call your doctor. You got his number, and say, look, It's not an emergency, but I got some conflicting information from two of your people. I need to know what the answer is. Can you help me out? Of course he's going to say yes. Okay?
Yes.
Makes sense?
Yes.
All right.
Makes sense. I'm going to go and warm up the clippers. I got some Anders adjustables. You know, I've been watching some YouTube videos on how to cut. Well, I used to manage a barbershop, but I haven't cut hair in a really long time because, you know, for a while I was just rocking the 00 against the grain, which was cool.
Yeah.
So
I get it.
Yeah.
I get it. All right. Well, James,
thanks, Joe.
You're welcome. I hope this helped. And I would say call back and let me know, but now I don't want you to. I want you to take a break. All right, because it's good for you to take a break. It's tough. It's tough. I'm going to tell you right now, it's going to be tough to do.
Yeah.
But just remember what I said. It's not going to make anything any better. It's not going to make anything any worse if you just let the hair do what it's going to do. Okay?
You know, one of the greatest statements that stick with me that you said was, good results don't need any assistance. So there you have it. I'm going to go and do my thing, shave it down, make it look nice and even, and relax.
I love hearing that. James, call me in 9 months, okay, buddy?
Thank you. Thank you.
All right. Take care, buddy.
You too. Bye-bye.
Bye-bye. That was an interesting call. And I'm glad James called in. He's got some good questions, and I think that what he's talking about and what he's concerned about and what he's worried about, a lot of people go through that. Well, I know for a fact they do because I've dealt with them. So, but yeah, it can be tough watching others online having early results or even growth. That's not the norm. That's not what happens usually. I stick with what I have been saying for 20 years. When you get a hair transplant, don't expect any growth, any signs of life from 3 to 5 months. If you get some, then consider yourself lucky and enjoy it. That's a fact. And when you see patients online recovering faster than that, ahead of the curve, it can be and is disappointing, and it makes people worry. I completely understand. I remember my second repair surgery. I was sitting in the consultant's office, and I was telling him, I was asking him. It was 5 months. It's like, is this all it's going to do? And he's laughing at me. He goes, "Dude, you're Joe Tronic. You're actually asking me this question." That was my nickname back then. I was really big on the forums, and he's like, "You know better than that. Why?" He's laughing. He's like, "You're Joe Tronic. You should know better than this." It's like, yeah, okay, you're right. And sure enough, it came in like crazy later. So anyway, line is open 1-833-563-4247. It's 4:48 p.m. We've had a good show. 12 minutes left. And you guys can give me a call if you got questions. Want to talk about hair loss, hair surgery. If you hear my dog, she's really... Come here. Come on. You want to get up here? Come on. There you go. My dog is bugging me. She wants some attention. My little dog. This is Masha. She is 1 year and 5 months old, I think, give or take. She's a very sweet dog, but she's very needy sometimes. So in the chat room, let's see anything to answer. Yo, guys, leave the call. Okay, yeah, guys, don't pick on any callers. William Lake, hey William, Joe, what do you think about forehead reduction surgery to address a receded and stable hairline? That is a good question. For men or for women? It's performed more often for women, and I think it makes more sense for women because they typically don't have male pattern hair loss. They can from time to time. Why is he texting me? He knows I'm in a show. But in general, for male pattern hair loss, receding hairlines, get down, I don't think it's a good idea because it's introducing. I think transplanting a hairline is easier, not to mention that the directions and angles of hairs behind the hairline that become. Actually, it doesn't. No, back up. Sorry. But I don't think it's a good idea as a first approach, simply because you can do so much good with a proper surgery for hairline recreation. You got more. I think you got more freedom because the canvas isn't so much. Well, I'll put it like this: when you do a hairline reduction surgery or a forehead reduction surgery, you do have a scar to contend with for a second surgery. It's a small surgery where you're just placing hairs into the scar and slightly in front of it, and it can work fantastic for men. I've seen it done, but I think it's best reserved for repair cases like Adrian. He's a patient of eugenics, hair sciences in India. He had a forehead reduction hairline removal in such a fashion where it's a strip to remove plug work. And it worked out great. He had a thin scar line that was visible if you looked, but it wasn't detrimental to his appearance. And then he went in and, eventually had his first tremendous surgery with Dr. Pradeep Sethi, and he had his second one. He's several months out from his second one, and that scar line was addressed in that second surgery. Looks fantastic. So, not a huge fan of it as a first line for men. I think with women, also not a huge fan of it. It is done more for women than men, but I think look at your normal surgical approach first before you consider something like that. I hope that answers your question. Let's see. Robert Hellner, Joe, after hair transplant, should you start right back on oral minoxidil? Ideally, logically you do, simply because you don't want to give your system a chance to flush everything out and for the medication to no longer be effective and then your hair be affected by that. But that's between you and your doctor. Your doctor probably asked you to stop taking it a couple weeks before surgery. So if you... I know some clinics, when topical was more popular, actually I think they still recommend this, will recommend topical immediately after surgery, like a day or two after surgery, because they believe that it does help to get the growth going sooner rather than later and more healthy. I've never been a subscriber to that thought process, because even patients that haven't been taking minoxidil, they would recommend minoxidil after surgery and stop after 1 year. I thought that was a I didn't like that at all. But oral minoxidil, I don't see why you can't start immediately. But talk to your doctor. I think it makes sense to me that you could do it if you wanted to, but talk to your doctor. See what he says. You're welcome, William, and you're welcome, Robert. Funtaz, how much is a hairline repair like that? Usually doctors will charge. It varies by clinic. It can be, I think, around $2,500 minimum. I've seen it go higher. It also depends on how much hair is being removed and will those hairs be recycled. It's usually a base fee for the procedure and then charge per graft on top of it if hair is being recycled. That's the way it usually works. I guess that's it. So, Tom Cotter, opinions on Dr. Deep. His results look fantastic on YouTube, but he rarely shows the crown or donor. I sigh because there's been a lot of controversy about him recently. I'll just say this. He when I looked at him several years ago, just because he was out there and like I was seeing his videos, I thought, well, he's got a lot of happy patients, apparently. My opinion of his work has always been that it's okay. But I always felt like it was, well, I'll put it to you like this. If he were in a position where he could apply to work with me, I wouldn't accept him. I'll just put it to you like that. I wouldn't accept him because of I gotta be careful how I say this. I just don't think it's as natural as it could be, according to my standards. I hope that's clear. Let's see. What else we got here? I'll tell you one thing that bothers me about his YouTube videos is the way that he speaks on camera. And I could be completely wrong about this. This isn't saying that this is the case. This isn't saying that this is how he is as a doctor or as a person. But he sounds to me like he's one of those people that he hears you speaking, but he's not listening to you. So that if I were to, he reminds me of people like that, where I've been in situations where I'm talking to someone and I'm trying to explain some details to them, and it's almost like a yeah, and they continue their thought process. It's like, okay, you heard me speak, but you didn't actually listen. So that's the impression I always had from him. I could be completely wrong. I don't know, but that's just me. All right, so 4:56, got 4 minutes left. Let's see. Any other questions? I can scroll up here. It's been a good show. Appreciate everyone joining me today. Let's see. Don't really see any other questions here. Milk drinker. Okay. We'll wind up. I'm going to unplug the phone here. No more calls. We'll wrap up the show today with a question from Milk Drinker in the chat room. He asks, if you stop finasteride after 20 years, will hair loss simply unpause, or will the DHT suddenly flood in 20 years in 1 year, or 20 years worth of DHT suddenly flood in as if there was a huge backlog of it somehow? Somewhere in between, a mix of both. So it doesn't matter how long you're taking it. And this applies to any hair loss medication, whether it be a vasodilator or whether it be a DHT inhibitor. That's the two types of hair loss medications we have, treatments. If you're doing anything to arrest hair loss, to slow or stop hair loss, the moment that you cease that method, then everything that you've been hanging on to because of that medication will fall out. And it will fall out at an accelerated rate, as I understand it, as I've always understood it. Doesn't mean it'll fall out in one day, but you will. I can't say it'll be in a year, as you asked, but if you stop it after 20 years, it won't take 20 years for that hair to fall out. It would be probably over the next, spitballing this, maybe 5 years. It could be a lot less. It depends on the person. Physiology is different from one patient to the next, but I think that as a baseline, that would be something to expect, that there would be varying degrees of telogen effluvium, maybe minor in some cases where it's just some sort of accelerated loss. In other cases, it could be dramatic. Just as we read about or hear about from patients saying, I stopped taking it after a couple of years. And then other people are like, why'd you do that? That was stupid. Same thing. Doesn't matter. 2 years, 20 years, doesn't matter. So I hope that answers your question. With that said, let's check out any final words, departing words I need to look at. Nope. That's it. Okay, everyone, thank you for tuning in for today's The Main Event. I'm going to try to be back tomorrow. No promises. We'll see how things work out as far as my schedule goes. But if I am, I look forward to seeing you get back here and getting your phone calls and texts or messages in the chat room. all that good stuff. Anyway, I'm out of here. Thanks for listening, guys, and watching. See you later. Bye.